I'm really pleased today. This is an important announcement. It's an important step forward for our health system, and most importantly, this is an important step forward for all the people we care for, and for the families of the people we care for, and for all of our colleagues, our staff who work within our system. Today, we are announcing that we are releasing some of the restrictions relative to visitation of patients within Hartford Healthcare. We will this week, the remainder of this week, be permitting visitors for all patients who are coming here for surgery and procedures. And beginning Monday and Tuesday of next week, we will be having visitation in place and visitors for all people who are admitted to our hospitals. This issue has been really difficult for us. Initially restricting visitation, and we were amongst some of the first systems in the country to restrict visitation. It was the right thing to do. It was the safe thing to do. We needed to take that decisive action to protect all of our colleagues who were working on the front lines, providing our services. And at the same time, it was essential to protect all the patients we were caring for and to try to limit the potential spread of this virus. But from the very first day that we restricted visitation within our institutions, we made a commitment to ourselves in this institution to say, we have to challenge ourselves at the very first opportunity where it's safe, where we have the right data in place that can indicate that we should be removing these restrictions, that we would do so. And I'm so proud today to be making that announcement within our system, and that will be migrating back beginning today into next week, really into bringing people back in. At Hartford Healthcare, we believe in patient-centered family care. It's the essence of what we do. And we know that involving people's family in their care gives greater advocacy, reinforces greater safety, greater emotional health and stability for the people we're caring for. There's numerous studies that show that it enhances the quality, care, and recovery for the patients that we provide our services to. So it's important now that we do feel and that we have data, and I'm going to invite several of our physician leaders today to speak to you to demonstrate really that this is a careful precaution. It's a thoughtful approach we're taking. It's one that we've looked at extremely, extremely carefully. But I'll just cite one example. We've done a major research study. The results are not final today. It's preliminary in nature. But we've discussed previously that we have been doing an antibody study of about thus far 2,500 people who work on the front lines of healthcare within our system. And as we've taken the antibody study, the prevalence for antibody positive has been approximately 6%. And again, these results are preliminary in nature, but it's giving us a good direction at this junction. And when we talk to the commercial laboratories who are our partners working within the community who are doing widespread antibody testing, their numbers are, again, approximately 6% within the communities that we provide services to. So that really demonstrates that the necessary actions that were taken within our hospitals, restricting visitors, the temperature taking, the screening we put in place for everyone who enters our facility, the fact that everyone wears a mask within our facilities, the incredibly focused effort around hand hygiene, all have been absolutely critical, and in particular the use and practice and systems we put in place around personal protective equipment. So when we see the early indications, of this data, it is showing that it's working. We're also looking at the massive testing that we do throughout our 9 permanent fixed locations and our 5 mobile units that go throughout Connecticut. So we're monitoring prevalence within the community, which has been low single digits, over the last number of weeks. So as we look at all this data and the fact that today we're down to 75 COVID positive inpatients within Hartford Healthcare, we're comfortable that we can make this decision and we can go forward. At the same time, I want everyone to fully appreciate that we are completely committed. We monitor this daily. We look at data. We look at practices. We have different auditors within our organization assessing practice to ensure that we can do this safely and that we're not putting anybody in risk or jeopardy within our health system, both the patients, the families who enter our facilities, or, of course, our staff members. So When people enter our facility as visitors, they will go through a screening process. They will have temperature taking. They will be required to wear a mask. There will be select places in which they enter, and there will be very clear guidelines about where and how they work through the building when they're visiting. And these are all necessary and appropriate precautions. We're fastidiously planning in how we do this so that we can do it safely. But again, most importantly, my commitment, what I'm most pleased about, is that we are doing it. This is the right thing to do. It's the thing we wanted to do from the very first day that we restricted our visitors, and we look forward to having complete and open access in the very near future as we continue to go forward, which is what we believe in and what we know makes a great difference for everyone receiving care when they're most vulnerable. So if I can, and we are, again, happy to answer all questions today, I'm first going to invite Dr. Adam Borgida, who's the chairman of Women's Health at Hartford Hospital, to come forward. And Women's Health has been on the front line of this issue. We have had visitation throughout this process for families who are delivering babies, and it's very important that we maintain that in place. And Dr. Borgida, I think, is well situated to speak both to the change in policies we have in place, and then I'm going to ask Dr. Faiqa Cheema from Infectious Diseases, who's one of the most important advisors and decision makers relative to when and how we put these new policies in place, how we monitor them, and how we ensure safety as we go forward. So if I can, I'm going to invite Dr. Adam Borgida to come forward first.
Thank you very much. Thanks for that introduction. Yeah, I think this is an exciting time going on right now that we can sort of pivot forward and start changing our policies. I do want to come back and talk about some of the perspective that we've had in obstetrics. Right from the beginning, we've had to make some changes, but really try and do what we can for our families, because we know that having a baby is such an important time in a family's life. So right from the very start, even though we've been careful and had to make dramatic changes to ensure safety for our staff, our patients, and their families, we've been able to have guests and at least a single visitor accompany every woman having a baby here. We also started testing. As the testing has gotten more robust, we can test every patient having a baby coming in. If it's a planned delivery, we have them get tested ahead of time, and if someone comes in with an unplanned delivery, as most of them are, we test everyone when they come to the hospital. It's important that we do that for the safety of our patients and our staff, but also it has an impact on the newborn baby and some of the policies that we have to enact. And fortunately, we've been able to really see, as the changes have come about, really great outcomes with our pregnant moms and their babies. We've also made some changes in our policies as we've gotten more information to allow moms with complicated pregnancies who have to remain in the hospital to also have a support person come and stay with them when they're in the hospital. And of course, when someone has a baby, they have a support person through their entire stay. Of course, we've had to make special changes to our units, and we have everyone wearing masks, including the guests and support people. But we've been able to overcome a lot of concern and ensure the safety, again, of our patients, our other patients and staff, and this has really been a success. We've had very good patient satisfaction, I think, through this whole time, despite the changes that we've made, and patients are extremely understanding of what we've been doing. As we move forward, we look forward to even more satisfaction and changes so that we can really ensure that patients are happy. We were talking earlier about the number of positive patients we've seen in the antibody study. We've been, as I said, testing all pregnant women when they come in, and we've seen for the last month or so a rate of about 4% patients that are positive. Many of them were known to be positive and have recovered from their infection. But some of them have been asymptomatic and detected, and our rates have been way lower than other areas, I think similar to other places that have been reported in Connecticut. So I think it is reassuring for families to know that not only are we testing, we're seeing low rates, and again, ensuring the safety of our patients, their loved ones, and their families. So as we move forward, not only changes to obstetrics, our gynecologic surgery and the other surgery programs, as was mentioned, we'll be allowing to have support people come in for their surgical cases. And again, this is an exciting change that we're doing with safety in mind, but to support all our patients as well. So I'm going to now introduce Dr. Faiqa Cheema from Infectious Disease, who will carry on the conversation.
Thank you for the introduction. Good morning, everyone. I'm here. You've heard so much about the necessary steps that we needed to take at the peak of the pandemic. As you know, this is an unprecedented time that we were facing. Those were very important and essential steps that we really needed to take to make sure that our healthcare providers were safe and also our patients were inevitably safe from the virus. We wanted to make sure that there would be no entry of any individual who could be a possible asymptomatic carrier, bringing the virus in to the hospital and possibly infecting not only the patients but also the healthcare providers. We take pride in keeping everyone safe, our healthcare providers safe, our patients safe, as well as our communities safe. As things have continued to evolve and are under better control, we feel that it's time to make some changes that are also essential. We welcome these changes, and we've made these changes based on science and thoughtful approach. And I just want to talk a little bit about how it was for all of us in the times when no visitors were allowed. It was a time when we saw that the patients felt very isolated and alone, and we knew as frontline workers we had to step in and be their caregivers, provide loving, welcoming support to them, make sure they were not afraid, they didn't feel isolated, and they felt that they had somebody by their side. I want to take a minute to really thank all the nursing staff that we have at Hartford Healthcare who displayed such compassion and such devotion to their careers. They stayed on at the bedsides of the patients day and night, relentlessly, talking to the patients in a loving manner, telling them they were by their side, holding their hand, helping them to communicate with their families with FaceTime, even through extensive PPE, wearing it for long hours. These were all essential steps that we took as frontline workers, which we felt were very necessary to make sure that our patients felt safe, welcomed, and in a place that was we were all prepared. If we have no other questions, if we have nothing else to say, we'll just take some questions at this time.
Thank you. As we advance to questions, I would like to say, I've spoken many times over the last number of weeks how I don't believe and do not want us to return to normal. I want us to be better than normal, and I expect we'll be better than normal. The types of things that Dr. Cheema was just speaking to, that's one of the many examples how we're going to be better than normal. The connectivity that we've had with our patients and families now, and the nature of the way our frontline caregivers have connected with their patients in many instances as their advocate, it's beyond anything we've experienced before, and it's something we're not going to lose. And the use of technology, the way we've been able to bring people in to our environment from near and far, those technologies we will continue to leverage those as we go forward. We're excited to do so. So if I can, both Dr. Borgida and Dr. Cheema are here as well. We'd be very pleased to answer any questions.
Good morning. It's Bridget from the Republican American. Could you explain that this means that system-wide there are visitors now allowed to all areas of the hospital system?
Yes, so it's phased. Yes, it's phased. So this week it's really we're bringing visitors in to accompany patients who are having surgical or other procedures. But if patients go to our website, they can get the specific information, but it is system-wide. And let me ask Dr. Cheema to come forward and speak to more specificity around the practices themselves. But it is system-wide. It does begin today. And again, we urge people to go to hartfordhealthcare.org to see the very specific information, which will be updated daily. Please.
Thank you. So all visitors will be screened upon arrival and must be screened negative in order to remain on site. That's really essential in the first step. The next step will be that the visitors will be required to wear a face mask at all times. And that's important too, because we know that studies after studies have shown that wearing a mask does significantly prevent transmission of the virus. The visitors will be asked to wait with the patient in a modified waiting area that ensures appropriate physical distancing. And when the patient is called for a procedure, the visitor may accompany patient to the procedure area where she or he will then be asked to wait until the end of the procedure in a modified lounge. If the patient presents with additional documentation that requires a companion, or if a clinical staff deems it clinically or psychologically beneficial, one visitor may remain with the patient in the care area for support of the duration of his or her stay, which just kind of affirms that, we believe in patient satisfaction and patient safety first. And we know that having visitors and family at the bedside really promotes healing, and we believe in that. Throughout the course of this week, we've been convening and talking with the local leadership. We will also be analyzing our own data and local transmission rates to further investigate and change policies. As you're aware, that things with this virus and this pandemic continue to evolve. This is not going to be one and done. We will look at the data, reanalyze, and we will see how we can readjust and pivot forward as we have shown currently since the start of the pandemic. Also, certain procedures may be allowed that may need to be addressed as we further expand our visitation policy in the coming weeks, so please stay on hold for that. This current plan that we have discussed currently focuses on the safety of our patients, which is our utmost importance. Also, of our healthcare providers, we want to keep them safe so they can be there to provide support and care for your family members, which is of paramount importance to us. And we want to make sure that we can be available to continue to care for our community, and our commitment that we have shown continues to evolve. Thank you.
Additional questions?
Hi, yes, this is Danielle with WTIC. I just wanted to clarify, I understand today begins with visitors for surgical procedures, and I just wanted to double check if I heard correctly, starting on Monday, it's visitors for all patients?
So yes, again, we urge people to go to our website, which is www.hartfordhealthcare.org, to check the specifics. But beginning on Monday and on Tuesday, it's a 2-day rollout. It'll be all access to all our services. The one exception is the Hartford Healthcare operated nursing homes and assisted living facilities, which are functioning under the executive order from the governor. And that executive order at this point takes us out into the early September. So with the exception of our assisted living facilities and nursing homes, all of our services will have visitors in place by Monday and Tuesday of this coming week. And effective immediately today, we are beginning with our all of our surgical and procedural areas.
Thank you.
Doctor, this is Raj Shazanin from Channel 3. I was wondering if you could just talk a little bit more about the importance that you have seen for patient care, for them being able to have visitors see them while they are in treatment.
Certainly. Let me ask Dr. Borgida to speak to that.
Thank you. Yeah, I think, obviously, as I mentioned earlier, from an obstetrical perspective, we're family-centered, and we obviously believe that having family support is important. From an obstetrical point of view, having a baby, it's an incredible one-time in your life experience that we really wanted to support our moms having babies with their support people. So right from the beginning, we've been able to accomplish that. And now we're happy to be able to, because of changes, because of more knowledge, because of the safety that we can ensure for our patients and our staff, that we can move forward and allow, the visitors, which we know it's so important for patients to have their loved ones there when they're going through a hard time, a surgery, a procedure, and we need to ensure that it's safe, but that they have the support that they need during this time.
Great. If there are no other questions, again, we thank you. We're really so pleased to making this announcement today. This is an important step forward, and we could not be more delighted to be bringing back all of our patients, welcoming all of our families, and support teams in place to support the patients we're caring for. Thank you so much.